Thank you very much for joining us. My name is Joel Torres, and I am the Senior Manager for Family Connections Adapt Coalition. I'm being joined by Donyea Wheeler. I'll have her introduce herself as well.
Hi, everyone. My name is Donyea Wheeler, and I am one of the coordinators of the Outpatient Mental Health and Substance Abuse Services at Family Connections.
And we are here to do a webinar related to building resiliency to help reduce substance use disorder during the pandemic. These are some challenging times that we're all dealing with in 2020, depending on whenever you watch this video. Well, we're currently in October of 2020. We've been dealing with the repercussions of the global pandemic that has been challenging so many individuals. And we thought it would be important to have a collaborative opportunity between adapt programs, between Family Connections programs, in order to assist with understanding more of not just prevention, but the challenges that individuals with substance use disorders are going through right now during the pandemic and how to help them build resiliency. So we have Donyea here, who has such a wealth of knowledge and information that can share with you some details regarding the topic. Before we get there, just a quick little info and plug for Adapt. If you have not heard of us or if you have not worked with us in the past, we are a coalition, which basically, in simplest terms, means we're a group of volunteers who work through all of Essex County to reduce substance use and to reduce and prevent substance use throughout the entire county. Our goals are looking at underage drinking, at prescription medication misuse and abuse, at tobacco and vape use, and also other drugs, and efforts to reduce its use and prevent its use, not just in our youth, but throughout the entire population. Our goals, first and foremost, are to build collaboration and relationships with various partners, including Donyea and our great connecting staff and partners in Family Connections, but also throughout the entire community of Essex County. We have great relationships with our schools, with our local officials, with our health departments, with our law enforcement officials. And it's a way to make sure that we create sustainable efforts to reduce and prevent substance use and misuse here in the county. Our overall goal by doing all of this, of course, is to improve the safety and the health of everyone in the county. We are made possible by Family Connections, who oversees and manages the coalition itself. And we are funded by the White House Office of National Drug Control Policy and the New Jersey Division of Mental Health and Addiction Services. These are the individuals who support us in the work that we're doing right now to improve the lives of residents in Essex County. And we continue to do that with the great support of our county officials and our partners here in Essex. So with that was just a quick way to give a little plug to the work that we're doing here at Adapt and who we are. Uh, you can learn more about us by visiting our website, www.essexadapt.org. You can also feel free to visit us at one of our upcoming events. Of course, right now everything is virtual, as you know, Donyea, with the challenges that we're dealing with. So you can go to http colon backslash bit.ly/adapt events, and you can find out more about what we're doing and how to participate. But without further ado, I want to make sure that we gave our time to our presenter today. After the presentation, we will be having a Q&A session from questions that we've received from the audience and from individuals who registered to watch our watch party on YouTube. We hope that you can join us and enjoy this video. If you're not enjoying it live, you can enjoy it at any time at your leisure by following us on our YouTube page, Essex Adapt on YouTube. But without further ado, I will pass it on to Donyea to begin the presentation and to get us the much needed information we need during these challenging times. So Donyea, thank you very much once again for joining us.
Thank
We
you for
appreciate
having
it.
me.
And the floor is yours.
All right. Hi, everyone. It's Donyea Wheeler from the Outpatient Mental Health and Substance Abuse Services team. And today I will be presenting on something that is extremely important, building resiliency to reduce substance use disorders during COVID-19. I would like to start by giving some quick facts about substance use. And these statistics comes from the National Survey on Drug Use and Health. And the survey is from 2019. And according to the survey, it shared that 57.2 million people used illicit drugs in the year of 2019. This basically means that that population of people engaged in illicit drug use. It does not mean that they have been diagnosed with a substance use disorder. However, 14.5 million people were identified as having an alcohol use disorder, and in that same year, about 2.4 million people had both an alcohol use disorder and an illicit drug use disorder. So we see prior to COVID-19 becoming a part of our lives that substance use in the United States was already a big issue, with about 20.4 million people over the age of 12 using substances, some of them using more than one substance. A few contributing factors, excuse me, a few contributing factors to substance use, are stress, experiencing a traumatic event, and lack of social support and connection. During this time of COVID-19, which we have been dealing with since March of 2020, there has been a tremendous increase of stress, particularly financial stress due to job loss or cut wages. Families choosing between working and being home with their children to do virtual learning and homeschooling, stress about our health and overall well-being. Um, so COVID-19 has increased the amount of stress that was already present in a lot of families. The next one, experiencing a traumatic event, um, going through a pandemic, losing multiple lives, turning on your TV and hearing about the lives that have been lost due to COVID-19, personally losing someone, and also just losing our sense of being. The pandemic has definitely shut a lot of things down, and a lot of us have been social distancing and isolation. And that leads to the third point of lack of social support and connection. As human beings, we are wired to connect with people. Um, we are naturally wired to seek social support and social connection. However, due to wanting to maintain safe, that has been decreased tremendously and isolation has increased. And with these things, stress, traumatic events, and lack of social support and connection, that leaves room for picking up poor coping skills, using substances being one of them. If you guys remember back in March or April, when all non-essential businesses closed, establishments that sold alcohol remained open, which then sends the message that alcohol is essential. And a lot of people used alcohol to deal with the stress of experiencing a traumatic event and the social isolation. So studies have shown that pandemics such as COVID-19 increases overall psychological stress, and the consequences of quarantine lead to emotional disturbance, depression, irritability, insomnia, anger, and emotional exhaustion. The list can go on, and it also leads to other health and mental health conditions, especially anxiety. Um, and this is what we have seen since March. As someone who is a direct care provider, I have seen an increase of stress in many of my clients. The stress of just being home, the stress of not being able to have those social connections have led to emotional disturbances, depression, and anxiety, and overall boredom. We also have to consider the impact that it has had on children. um, Children, their whole routine has been interrupted. They're no longer in school. They're no longer seeing their friends. They're learning to adapt to learning virtually, and it has, created stress in families. The overall psychological stress as a consequence of COVID-19 has led to many other issues. And it leads us to this revolving door of things. So, overline, we have quarantine. In quarantine, we have COVID-19 fear, the worsening of cycles, emotional conditions, and an increase of substance use. And these three factors can act as a revolving door. One can lead to another, they can work forward, they can work backwards, and the big factor is they all interact with one another. So while many people are quarantining and following guidelines that are in place by the CDC, there's time to ruminate and really sit in this fear and this anxiety that has been provoked by COVID-19. The increase of ruminating thoughts and intrusive thoughts and fear and anxiety leads to an overall worsening of social, psycho, emotional conditions, which then leads to poor coping skills. And one of those poor coping skills possibly being the increase of substance use or the starting of using substances. And with continuously using substances, and then leads us back to the worsening conditions of our emotional state. So since March, I have seen an increase of clients presenting with increased anxiety, increased depression, and increase of suicidal thoughts. And the things that I've seen in my day-to-day work has been directly in line with what the CDC has seen. So back in June, the CDC found that 40% of US adults reported struggling with mental health or substance use. And we can see there that substance use either increased or started has increased by 13%, and this was taken in June. We can also see that with the increase of anxiety and depression and trauma and stress related disorders and symptoms, there's an increase of substance use. So when we think on the bigger scale, we think of mental health and we think of co-occurring disorders being mental health and substance use disorders. Interacting comorbidly, we see that there has been a drastic increase, and COVID 19 has been a contributing factor to the increase of symptoms overall and the increase of use. So far, even though we're not even a year into this, statistics have been really shocking. So far we have seen that alcohol sales have gone up by about 25%. And as I mentioned earlier, alcohol distribution was seen as essential when non-essential businesses closed. So we have pharmacies and, supermarkets and things where we get our essential needs from. And then we also have, stores that sold alcohol, and those sales have risen by 25%. Um, Statistics from Millennial Health have seen that 500,000 urine drug screenings that were collected. There was an increase of 32% for non-prescribed fentanyl, an increase of 20% for methamphetamines, and an increase of 10% for cocaine. And those statistics are from mid-March through May. Lastly, we've seen that suspected drug overdose have climbed 18% during that same time period. And that one is really alarming because so many people are now using alone. Those of us who are trained to administer Narcan and to respond to signs of overdose, we are no longer in the spaces where we can act because we are socially distancing. So due to this pandemic, we have seen an increase in overdoses as well as an increase of use. And the big question is, when does it become problematic? If I'm home and if I'm taking care of my family and I'm doing all of these things, when does my use become problematic? And here's just some quick resources to kind of do like a self-assessment of when the use can become problematic. So the first one is feeling that you have to use regularly or daily or several times a day. After a long day, for some people, possibly having a glass of wine is a norm, but having multiple glasses of wine throughout the day, every day, can start to be problematic. Having intense urges or cravings to use to block out any other thoughts. So there we go. We're using the substance to cope with negative thoughts, those thoughts possibly being related to COVID-19. Building up a tolerance, as time progresses, needing more of the substance to get the same effect. it was possibly a time where, smoking, one joint of marijuana, produced euphoric effects. However, since March, you've increased to maybe two or three to produce those same effects. So there's been a buildup of tolerance, which leads to consuming larger amounts of the substance over a longer period of time than intended. At times, use starts off as recreational and as social, and then that use becomes a part of a routine, and then becomes problematic. A big thing is spending money on the substance, even if you can't afford it. Like I said, there's been an increase of financial stress, and many people are using their funds to cope, which means that they're buying substances that they necessarily cannot afford. However, they're using it to cope with their emotional distress. Not meeting obligations or work responsibilities, when the substance then interferes with the ability to meet those obligations, whether it's for employment, whether it's within your family, parenting, or any type of obligation. The substance now is problematic because naturally you start to cut back on the things you used to enjoy, um, to use the substance more. And lastly, continuing the substance despite having any negative effects that have been associated with your use. So when, wondering if my use is problematic, or if you're looking at a family member and you're wondering if their use is problematic, or is it social, is it recreational, here are 7 things that you can kind of go through to either self-assess, or, kind of assess someone else. So then you can know what help is needed. As I keep mentioning, the negative coping skills. As humans, we like to feel good. And since COVID 19, there has been an increase of so many things that do not make us feel really good. There's been an increase of emotional distress and psychological stress. But I would really like to stress, under no circumstances should you ever use a substance to deal with your feelings of anxiety, boredom, or social isolation. You should never use a substance with an idea that it will protect you, or treat an COVID 19 infection or symptoms that may be related to COVID 19. And and lastly, a substance will not protect you from COVID 19 or help you deal with your emotional stress. What it actually does is exacerbate the stress that you already are experiencing. So the goal would be to find healthier coping skills, and a big part of that is finding positive social connections. So here we have a video from the director of the National Institute on Drug Abuse, and she'll just give us a few skills, or a few things that we can use to cope with COVID 19 during this time.
Dr. Volkov, let's start by talking about the risks of COVID. What do we know about possibly increased risks of contracting COVID or getting a more severe case for people who are struggling with addiction or who are in recovery?
Well, it is a new pandemic, so we don't have much data that has emerged that can actually give us the evidence of exactly what is it that happened. However, because of what we know of COVID, recognizing that certain comorbidities, particularly pulmonary and cardiac, are going to put you at greater risk, we can clearly actually predict that individuals with a substance use disorder are going to be at higher risk of adverse outcomes from COVID, because they are much more likely to have these comorbidities due to the effects of drug exposures in pulmonary and respiratory diseases. The other component too that relates to infection, the risk of infection, we know that if you are addicted to drugs and you don't have a support system and you are actually out there in the streets trying to get these drugs, you're much more likely, therefore, to encounter conditions where you may get infected. And we also know on a third level is that many of the drugs of abuse themselves indirectly or directly affect the physiology of our bodies. So for example, if you are using opioids, that produces respiratory depression. And respiratory depression leads to lower oxygen content in the lungs, which of course makes you then much more vulnerable for any infection that is going to be targeting pulmonary function. These are three of the events that we can actually, from which we can predict that individuals with a substance use disorder.
What are some of the challenges that people in recovery specifically might be facing now?
I mean, we are social creatures, we human beings, and we depend on social support in order to actually do many of the things and for a sense of well-being. And this is also the case for individuals that are fighting drugs or are on recovery. The social supports are fundamental for providing a structure that will increase the likelihood that they will succeed. So as we in the COVID epidemic have had to exert social distancing, this can make it much harder for those that are trying to achieve recovery or are on recovery to stay on recovery when those social structural systems are no longer there.
And also so challenging people who are now struggling with substance use. What do they need to know in terms of challenges that are out there? And also, what do their friends and family need to know and possibly that they could do to help?
Well, like anything that has such a tragic effect on our society, it leads us to come up with solutions. And some of those solutions actually can, if taken advantage of, can significantly help outcomes. So if someone is addicted to drugs and they see these services in the community closing down, it is very important for them to realize that now there has been an expansion on access of telehealth applications that enable them to receive treatment or support, including social network support through these applications.
You've seen firsthand how stigma can take a toll on people who are struggling with addiction. What lessons learned have you seen from your work that we should keep in mind now during COVID?
I think it is very relevant that we all recognize our emotions when we are faced with someone and be aware that we are under very stressful conditions and that we have to learn to be more tolerant to diversity as it relates, of course, in general to all different ways of looking at the world, but importantly, as it relates to someone that may come or need help, being able to create that sense of trust on the person that is suffering from addiction so that they can seek out the help is also very important.
So there we've learned and gained a lot of information. Just overall, those who are using substances are at higher risk for one contracting COVID-19 and for it to be really bad for them and for their health because of the relationship between their substance use and their overall physical health. So the big question is, what can we do? What can we do now to help reduce the substance use or to provide support to other people?
Well, there are
And there's support everywhere. The the helpline, the national helpline, is one of our greatest supports. It is totally free, it is totally confidential, and it is available 24/7, 365. And information can be provided in English and Spanish for individuals and for families that are facing mental health or substance use disorders. During this time, all of the support meetings have been moved virtually. So we have virtual recovery programs. We have Alcohol Anonymous, Smart Recovery, Unity Recovery, Narcotics Anonymous, Marijuana Anonymous. And the big thing is, what can we do for the families? Just like there are self-help meetings for those who are actually active in their substance use, there are self-help meetings for families. And those meetings are Learn to Cope and Al-Anon family groups. And with these, you find support from people who really understand you, where there is, no judgment and you're met with compassion. And it is not our ideal because we are, accustomed to meeting in person. But to be safe, we do have the option of seeking these things virtually. In addition to that, we as individuals have the ability to check on our family members, check on our loved ones. We can use social media, we can use Zoom. There's a lot of technology and there's a lot of platforms out there that we can use during this time to connect. And if we are in areas where we can connect and practice social distancing, we should do that, of course, while remaining safe. Additional online support. There are free apps. I know many of my clients use the app I Am Sober, and that app is great for, just accountability and maintaining your recovery. You can count how many days you're sober. You can count the days where, that were really rough, the days where there has possibly been a relapse. And, it can really help you identify what are your triggers, and it can lead you to finding support in your family members. So right now, everything is virtual and it is not ideal, but we are still doing our best to provide the help and the treatment and support. I know for me in my program, we have been providing, telehealth services since March. And, our clients are still able to have their weekly individual therapy once or twice a week. They're still able to see their psychiatrist, still have access to the therapeutic services. And we're working on, getting a platform so we can continue our group therapy to increase the social connection. So we are doing our best to maintain treatment for those who really need it. And the big thing is overall, we have to care for our mental health. We have to listen to our bodies. We have to take breaks and relax when we can. We need to exercise and, maintain a healthy diet when possible. A big thing is to reduce our overall anxiety, actually getting to know the facts and understanding the risk. Um, so we are not always on edge and worried because we actually know the medical facts. We've done our research. And I believe the last two are the most important. Stay connected. We are social creatures, and I will keep pushing that. We are social creatures, and when we are around positive support and having, the ability to socialize, it decreases that isolation, which then decreases the ruminating and negative thoughts that can lead to substance use. And definitely ask for help if feelings become too overwhelming. We're all a bit overwhelmed and we're all a bit on edge with the uncertainty. But reaching out and, finding support from other people, and at the same time being able to provide support to other people to talk about these feelings that we're experiencing and normalize the anxiety and the urges that we may be having. It's all very important. And I would like to leave you with a quote. So, the opposite of addiction is not sobriety, it is human connection. And during this time where our human connection has been decreased due to COVID-19, the best way we can build the resiliency and reduce substance use is by connecting as much as we possibly can, using the technology, using the platforms, even writing a letter if we have to, showing support to someone, letting someone know that, we're there for them, picking up the phone, checking on someone. And when you're not sure, use the resources, call the hotline, reach out to your local substance use agencies and see if there's any resources that they can provide. We've been using telehealth since March and we've become pretty good at it. And if there's something that your local agency cannot use, they can definitely refer you in a direction to where you can get help. So definitely, it's not only focusing on the sobriety, but it's about focusing on the human connection and providing supports to those who are in need. Thank you.
Well, I've got to say, Donyea, first and foremost, thank you very much for an amazing presentation. Very informative, very helpful with helping us, not just the folks who are in the field and understand it, but just the average individual understand the issues, understand the topic, and understand any resources that they can utilize. So I want to say thank you very much. You did an amazing job with the presentation.
Thank you for having me.
And I think you answered some of the questions that were brought up for the Q&A, but just out of respect for the folks who submitted their questions, I'm going to just share some of the questions that were brought up. You can see the screen, right?
Yes, I can.
Okay. All right. So um, we'll do a little question and answer. And I'll say during the watch party on YouTube, if anybody has any questions or comments, they can drop it in the chat box. And then from there, make sure we'll pass on any questions over to Donyea and see if we can get those answered for you, uh, so that we can make sure that everyone is aware of any insight and information that Donyea can share with us. So first and foremost, with the questions, uh, one question was, why don't we have more long-term support as per years for this lifelong disease? So I'm going to assume that they're saying we know individuals are dealing with the struggles of substance use disorder, not just until they reach sobriety, but then also throughout their entire life. So I guess the question is saying, why isn't there more long-term support for these individuals?
There actually is. There's a lot of support, for long term. There's no time limit on attending self help meetings. There's no time limit on attending AA or NA meetings. And I would say most people who are engaging in self-help meetings, they engage long term. Early in sobriety, they may go to a meeting every day. As they become more stable and confident in their sobriety, they then may decrease the amount of meetings they attend. They possibly go once a week. um, there's also a lot of people use religion as long-term support. So it is there. There's ongoing therapy. You may have achieved abstinence, but want to continue therapy to focus on any daily stressors that can come about. So there's definitely long-term support out there. It's just a matter of seeking it.
Thank you very much. Now, the next question was, um, somebody saying, since most of their services for individuals with a substance use disorder are directed towards low to no income individuals, what are some of the resources available and accessible for those individuals without a communication device, such as a cell phone with video, or a computer at home?
That's definitely a tough one, especially during this time because we are using a lot of technology. I can say on some platforms such as Zoom, you have the ability to just call in and participate with audio only. I believe you can also do that on WebEx and Google Meets, where you can, participate with audio only. Um, there have been certain clinics that have opened up to have in-person services, of course, at a limited amount. So definitely ask questions, call places, ask the providers, what's available. But it's definitely tough during this time where we do not have the communication devices.
Very true. Another question that came up was, how does the current pandemic that we're in compare to other large scale natural disasters when treating individuals for either their substance use disorder, PTSD, grief, or loss?
I would say that there is no scale. Someone's experience is their experience, and we cannot put a size or a scale on trauma. Um, everyone has been affected by COVID-19 in different ways. So if someone is, affected on a larger scale, we must validate their experience, and not minimize it or compare it to other natural disasters, and treat the presenting problem. If it is PTSD, if it is grief or loss or anxiety or depression, regardless of what the trigger is, we must treat them all.
Okay. How can you help someone dealing with a substance use disorder stay connected or not feel isolated during these challenging times? I know you mentioned it uh, in your presentation, but if you just want to give that detail of context for folks who are wondering that question, since we know that's isolation is a big issue now.
Isolation is a huge issue. And I would say we just have to use what's available to us. There's been so many new groups created on Facebook to just connect people. I personally have clients who engage in NA and AA meetings with people that's kind of like all over the world. So they're getting a different perspective on life outside of just being in New Jersey. Um, So we just have to use the resources there. And the last thing I would say is, checking on our family members. We know we may not be able to see our family as much as we would like, but picking up the phone and just checking in, to just providing that support, even though we may be physically isolated, it doesn't mean that we have to be emotionally isolated from the world.
Perfect. Do you have any recommendations or ideas to reduce drug overdose or support individuals at risk of overdosing? This is a very, I know this is like a big, one of those big,
It is.
big questions, but
It's a very big question. I would say that medication assisted treatment definitely works. And when I say that, I mean, methadone treatment, Suboxone treatment, using naltrexone, if it can be, provided. Um, I wouldn't suggest anyone stopping completely without seeking medical detox because of the risk, but definitely seeking medication assisted treatment. And a lot of times that start with just going to your primary, or researching your local clinic and seeing what's available. Methadone clinics and Suboxone supply has not stopped during this pandemic, and it's definitely helping those who are at risk of overdosing.
thank you. Finally, just this is a greedy one, so this is a question from us here at the Adapt team. What would you suggest for a coalition like ours to do to help prevent or reduce substance use in the area during these challenging times?
I would say really getting into the community on a social, aspect. Social media has been so huge, um, especially like using like Instagram Live, or any of those platforms. If there's any way where you can possibly, connect with other organizations who are doing things, or even connecting with schools, and maybe having a message like on, the school website, which can be posted to the Google Classroom, which every student will see. But just connecting and just, sending a message. Most people, they don't see something because they're not looking for it. But once we put it in their faces, it's like, wow, help is there, support is there. So we can find a way to just connect with other people who are already in everyone's faces all the time, and just throw that shameless plug there. It's getting the support out there.
Awesome, thank you. And just a shameless plug, yes, we've been doing IG Live, so at Essex Adapt on Instagram and Twitter, and also you can search up Adapt Essex County on YouTube, and you'll find us. We actually had a kickoff event for our youth leaders, our Incorruptible Essex group, on Friday. We're looking to almost double our youth leaders and the work that they're doing. So just a
That's
shameless
really
plug there.
amazing. That's amazing. I mean, with teenagers, we have to really step into their worlds and connect with them in which they would like to connect. I know for me, I email my teenagers because calling them, they will not answer. But if I send them an email and add an emoji to the end, I will definitely get a response.
That is true. Yeah, I've got to thank Jessica and Emmeline from our team. They had a great event, but we also have a very dedicated and motivated group of leaders who are taking things by the horn themselves, and they're just running with it, with whatever leadership opportunities we give them. So they're running the show. We're just here to support them, and we're excited to see it grow. So we appreciate that information and that
Mhm.
support, and we just want to throw that shameless plug out there for anybody at Incorruptible Essex. Also, I believe incorruptible.essex on Instagram. You can check out our youth leaders too. Uh, well, those were all of the questions that we had received. I know there was a question pertaining to transportation and the challenges with that, but now with the pandemic, looking at the challenges of telehealth. But you kind of answered that with the question about resources for individuals who might not be able to access it. So I
Yes.
appreciate that. Anything else you wanted to add?
I would say just in regards to transportation, Logisticare and Access Link are still very active. You just have to schedule your rides, and they can help with, just getting to appointments. Some psychiatric services are still in person, and they can definitely help with that.
Oh, awesome. And just want to say thank you once again, Donyea Wheeler. She is an LSW and the coordinator for outpatient mental health and substance abuse services at Family Connections. You can learn more about Family Connections at www.familyconnectionsnj.org. And we appreciate your time here, Donyea. We appreciate your very informative presentation and how you made it very easy for anyone to learn the information. There was no technical jargon in there. There was nothing that would be over people's heads. It was a very straightforward presentation, beneficial to anyone who needed it. So with that, I say, Donyea, thank you once again. We appreciate that. And we hope that if you have any questions or any comments, you can certainly put them in the chat box for our YouTube page and the comment box on our YouTube page for this video. And we'll make sure to get anything to Donyea to answer in the near future if we get that. But with
Yes,
that
thank you
said,
so
I'd
much
say
for having me.
thank you and have a great one, everyone.